Welcome. I'm Steve Bauer, President of the College of American Pathologists. Medicine is always evolving, but today we find ourselves in a period of particularly rapid change as a result of the evolution of disruptive technologies, the expansion of medical knowledge, and changes in the structure of our healthcare system. All of these require that we transform our specialty of pathology to keep it at the cutting edge of medicine. The CAP Pathology and Laboratory Quality Center will be a key part of the college's initiatives to respond to the evolving environment. The center is only the first of the college's transformation initiatives. It will be followed by an institute to provide education to promote transformational roles for pathologists, a knowledge exchange, a center for informatics, and a policy roundtable. We're fortunate today to hear about the center from Dr. Liz Hammond, who has been instrumental in the creation of the center.
Welcome. I'm excited to talk to you about the center. The center has been created to help pathologists improve patient care and patient safety by helping them make more accurate and timely diagnoses. The center will also position pathologists to be in the middle of the healthcare decision-making team. The real name of the center is the CAP Pathology and Laboratory Quality Center, but we're really just going to call it the center. The center is going to be responsible for creating guidelines, position papers, and protocols, much like the CAP has been doing for about 60 years. But there's a real difference in the new process, and that is that we're going to have a dedicated professional staff and enhanced resources. So instead of just producing guidelines, we're going to produce those guidelines in association with tools and other strategies to make it possible for the guidelines to actually be implemented in practice. Some of the important CAP guidelines are the cancer protocols. I know a lot about the development of the cancer protocols and what a long and onerous process it was, because I was chair of the cancer committee when the first version of the cancer protocols were published. At that time in 1997, we were having to do them one by one with a multidisciplinary group of pathologists and other cancer specialists so that we could make the very best information about how cancer samples should be examined. It was a very involved and complicated process. We ended up with wonderful documents that were published individually in archives and then were basically put on the shelf. But fortunately, after that, times began to change and the wind shifted and other things happened that made it possible for us to actually get those cancer protocols implemented.
Hi, I'm Dr. John Olson, Scientific and Medical Director at the CAP Pathology and Laboratory Quality Center. I'm also an anesthesiologist, spent 20 years in the Navy Medical Corps, and veteran of Operation Iraqi Freedom. Most recently, I come to CAP after having led a team with global responsibility in medical pharmacovigilance and device safety in the pharmaceutical industry. I enjoyed my time in the Navy. The Navy offered me opportunities to pursue graduate degrees in addition to 20 years in the operating room as an anesthesiologist. A career in the military can't help but build a strong sense of purpose and mission. I've seen firsthand the benefit of direct communication, the strength in building a team, and the power in having the team build toward a consensus-led decision. We hope that our center team can approach the development of guidelines, white papers, and even the formation of the work groups in a similar manner. The center is one piece of a larger transformation initiative, yet the center's mission is quite pure and simple. It's to focus on patient safety and build guidelines and white papers to support that. The college had great success in implementing the Cancer Center protocols. We hope to borrow quite heavily from that success story, not only in building out a solid organizational design of the center, but also in the procedures, the processes that will help us institutionalize the guideline development process at CAP. You know, those ideas, they come from you. It's really quite easy to just go to the CAP website and download the guideline idea submission form. We create guidelines where the evidence is compelling. We create white papers or consensus statements where perhaps the evidence is still maturing and not at the same place where it may be able to build an evidence-based guideline. Our guideline selection process better ensures a proactive approach for the pathology community in addressing quality and patient safety. The guidelines certainly provide our college and our membership a very visible role, a very proactive step into the community where we're enhancing, ideally, the delivery of high-quality patient care in pathology and laboratory medicine. It also offers the opportunity for many collaborations. The patient-focused and evidence-based guidelines provide many opportunities for us to partner and collaborate with medical specialties and other standard-setting organizations. Our hope is that that in turn creates a more robust and broadly defined guideline. We certainly don't underestimate the power of collaboration with our partners. You need only look at the current guidelines under development to see that we've taken a very proactive stance toward seeking those alliances and partnerships in building our guidelines. Our partners are very diverse, and we hope to always expand them, not only this year, but in the years well into the future. On the screen, you can see a list of organizations that we're partnering with at the CAP, all of which are focused on improving patient safety and quality. In order to achieve wide dissemination and the broad adoption of our guidelines, we hope to deliver with those guidelines a broad set of tools, a communication plan, and even education opportunities. One need only think back to the very successful toolkit that was rolled out during the cancer protocols. The center is currently working on several projects, and we hope to do several more next year and the year to follow. Here are some guideline initiatives in which the center's been involved. So here's how you can get involved. Think about your daily practice and where you could implement a clinical-based guideline where the evidence exists, where specific actions that you could take would reduce the variance that introduces risk in patient workup and diagnosis. We especially worry about that variation that can introduce the downstream risks to patients. Help us identify specific topics and submit the idea form. We welcome your ideas throughout the year. The actual process of the guideline selection begins in earnest in the third quarter of each year and will undergo the formal review into the fourth quarter and acceptance for the future year. We will launch those work groups throughout the entire year as we build the topic in the actual work group that will undertake the guidelines development. The center is but one piece of a multi-year, multifaceted transformation at the college that's looking at the expanded role of the pathologist. As scientific research and emerging technologies evolve, we hope that the pathology community, working with CAP, will look at the near-term horizon, but also beyond the horizon, where opportunity may lie. Help us take that first step by getting involved with the college, and even better, getting involved with the guideline process. Evidence-based guidelines offer the opportunity to improve patient safety by reducing risk. There may be the added outcome that by standardizing approaches, we may more efficiently also achieve the same healthcare outcome for any given input of healthcare dollar. We look forward to sharing projects like this with you. We look forward to your participation in the work groups, and we look forward to you helping us create the future.